Dina,
Hey Bob.
vitamin sunshine.
Well, I don't see much of that happening today. What's
It's
going
it's
on with my weather situation?
it's so funny because we're what, maybe I don't know, 40 miles, 50 miles away from each other, and it's snowing by you and it's completely sunny and blue skies by me in Colorado.
Yes,
So
yes.
it kind of rolls into what we're talking about today, and that's vitamin D and the importance of vitamin D and maybe the inefficiency of getting vitamin D, even if you live literally 40 or 50 miles away, right? But
Yep.
vitamin D is like, I kind of feel the reason we're talking about this. I mean, we could talk about this any day, any week, any month of the year. It's so important. But obviously it's winter time for at least, those of us in the northern hemisphere. So, I think vitamin D, although is it a vitamin, which we'll get to, is such an important topic and nutrient to talk about. And I'm going to back up what I just said because there is such a high degree of deficiency among the population. I was going to say
Mhm.
Americans, but just the population in general. Do you agree?
I do agree, Bob. Just looking too and thinking of the work over, the last 15 years, looking at blood work from all kinds of people, all kinds of athletes, all, locations geographically. It is a common theme to see subpar levels of vitamin D. And yeah,
Well,
vitamin or we'll talk about that.
we'll
But
talk about that. Yeah.
do you
Well,
have
and
the latest stats on deficiency?
I don't. I
I don't
don't. It's
I don't have
yeah.
those handy, but I think it's pretty high, right?
It is pretty high.
Yeah.
Well, and here's the thing that this is why it's high, or this is actually why it should be higher, to be honest with you, because based on where you live and based on the lab that you may have your vitamin D tested, of which, by the way, everyone, it is super easy and very, very economical. This is probably one of the cheapest blood work tests you can get by itself.
Hmm.
But it just requires a little bit of blood, and it's super, super easy to do. But I digress. The thing is, depending on where you live and what lab does this, every lab has different population standards of the normal, quote unquote, normal range for vitamin D. So the normal range here in Colorado is 0 to 30 ng per dl. That's nanograms per deciliter, right? So great, but I've had athletes around the world, around the country, come back, and I've actually seen the blood work results from their lab, and it's not 0 to 30. Maybe it's 0 to 25. Maybe it's 0 to 35. Like it really depends. Like I was confused about 20 years ago. I'm like, why isn't this standard? And it's not because of geographic location, right?
Hmm.
So my point is this: even though maybe vitamin D, deficiency is, let's just call it, I don't know, 70%. I don't know what it is, 60%. It's high, right? But
Yeah.
I feel like it could be higher because our results and our levels of vitamin D levels for athletes that we like is different than a physician lab, right? So maybe a 30 is okay for vitamin D levels. For me, that's about 50% of what I like for athletes. So it's actually deficient, but it doesn't get flagged as deficiency. This was my point, Dee. So when we see these deficiency statistics, it's not looking at athletic ranges, it's just looking at general population. So I actually believe it's a
Right.
lot higher. In all the testing I've done with athletes, I can 100% say that almost every athlete that I've had measured is deficient in some way.
Yeah, you're bringing up some good points, Bob. Like the lab reference ranges on blood work reports we get is not standardized across because for different reasons. However, I think even within a same geographical location, two different labs may have
Yeah.
slightly like a 10 point or 10 unit difference in
Mhm.
what's considered a deficiency. And then some labs will say like it's deficient or insufficient, or I
Yes,
forget the other
yes.
term. And then there's like optimal. And then like the upper end of the range, on the flip side is like, well, how high can I go? And even that
Yeah.
is different across labs.
Oh,
And
totally.
then like the prevalence of deficiency here in the US. And we're not even talking about like different risk levels other than
Mhm.
geographical location at this time. But I just did a quick Google search while we were talking, and it looks
Yeah.
like, and this isn't fact checked, but around 35, 40%
Okay.
of
Okay.
it. but that goes up in deficiency risk based on ethnicity and skin
Right.
color, which are things
Right.
we can go into as well.
Yeah. Well, and again, just to reiterate, so listeners, just remember, we're talking. So those let's call it 35% deficiency is population standard, population based, non-athlete, I would assume, right? Because
Yeah.
it's not
Yes.
using the standards that we have as sport dietitians is very different than the standards that physicians have in a lab. Okay.
Yes.
So
Yes.
that said, let's work off this. So I guess let's get into it. Vitamin D, vitamin or hormone? Because every time I pose that to someone, like an athlete, they're like,
Yeah.
"What? Hormone?
I know. How's that
What
a
are you talking
hormone?
about? How? What? Why do they call it vitamin then? I mean, what's the deal? Do you want to chat about this, or I feel like our listeners
Yeah.
should get a little info out of this.
Well, I can start. Well, okay, Bob, there's like vitamin in the sense it is essential for
Right,
our livelihood and
right.
existence, right? So it being some sort of nutrient that we need for survival.
Hmm.
But I believe kind of technically, when you look at the structure
Hmm.
of the active form, it's more hormone-like in its makeup. Is that kind of
Yeah.
simply said?
Absolutely. Yeah, I
Okay.
think that kind of covers it. And because it acts on so many different body processes, which we'll get into a little bit later too. And that's why, like, again, that's what hormones do, right? Sometimes
Yeah.
vitamins, while they do cross the path of a couple different processes in the body, hormones literally target, I mean, like just about every process in the body. It seems like, right? I mean, you look at
Yeah.
the hormone in it, and there are so many different pathways involved with hormones. So that's and
Yes.
and I don't feel like we need to nitpick this. I don't actually want to get into the biochemistry and the organic chemistry of it because that to me that's not like listeners, if you can Google that, right? If you want to learn more about that, our goal is just to tell you that hey, it is called vitamin D, but it acts like a hormone. In fact, some people are arguing it is a hormone or a
Yeah.
pro-hormone. But it has hormone tendencies, and that's why we sometimes refer to it as a hormone. But listen, we're never going to say, oh, the hormone D or the hormone
Yeah.
vitamin D, right? It's so we know it as vitamin D. So let's just kind of leave it at that because I feel like we're not going to go into a deep dive into the science because we want to get into the more real life, right?
I will say though, just saying to reinforce why we're not talking about some of the biochemistry and all of that is not because we're lazy, but
Yeah.
it is quite complex looking
Mhm.
at all of the, and when we can touch on, like how do we actually get vitamin D through food, sunshine,
Mhm.
and the others supplements, but like the whole process and conversion and mechanisms and things, it's pretty complicated and complex. And there are researchers that focus their whole lives
Yeah.
on this single nutrient or single pathway,
It's so
which
true.
is
It's so
really a
true.
lot of pathways.
Yeah. Well, and it is. And you pick up any biochemistry book and that affirms that for sure,
Yes,
right?
yes,
I think another question is because we see this all the time with supplements, vitamin D supplements, is vitamin D2 versus vitamin D3, right? And sometimes like I'll ask athletes this, so what kind of vitamin D are you taking? They're like, the white bottle one or the green bottle one or
yeah. What do you
and so
mean?
so it's just not like it's not well known, right? So it's and I had to do a little bit digging of this too, because sometimes, you look on the label if you do take a vitamin D supplement, and sometimes it doesn't prominently state if it's a D2 or a D3. So
Yeah,
D2, and there are some differences. D2 are usually found, at least in foods, it's found from plant-based foods and fungi, right? Depending
yep,
on where you're from to pronounce that word. And then the D3 is more from animal-based products like fatty fish, cod liver oil. We'll talk about this, but some from mushrooms. So, but I'm sorry, that's not animal-based. But eggs, right? So there are some differences between D2 and D3. So D2 is called ergocalciferol. D3 is called cholecalciferol. So you can actually look at the back of a vitamin D supplement label in the ingredients, and it'll always tell you if it's ergo or cholecalciferol. The point there I want to make, because I had to do a little bit of digging on this, is it appears that vitamin D3 is going to improve your vitamin D levels in your body more efficiently. So it's not too, like if we have our vegans out there who are like anti anything animal, even a vitamin D3 supplement, that's fine. You still take the vitamin D2 if you need to, but just know it may not be as efficient or it may take longer to get your vitamin D levels up.
But I think that is important when we're looking at supplements or D content in foods is like, yeah, it's not same, same. There are differences in that
Right.
form. And then how it is absorbed in the body, which we can touch
Mhm.
on here coming up. But the point just being, yeah, well, there's a lot, right? There's amounts,
Mhm.
form, our own intestinal absorption, and then of
Yep.
course our own genetic
Yep.
variants, which we can get into
Exactly.
as well. So,
Exactly.
and then of course risk levels. What's our starting point? What are the characteristics that set us up for having or being more predisposed to a
Yeah.
deficiency?
Well, let's jump
So,
into that. That's a great. So now we kind of know we talked about, is it a hormone? Talked about a couple of the different types, the D2, D3. Now let's get to the brass tacks. Like let's talk about like why would someone be deficient? Why do we even care? Right? I mean, we'll get into the whole benefits and why you need vitamin D, but why could you be deficient? And maybe I'm not deficient. I mean, we both live in Colorado. It's sunny most days of the year, right? I mean, what's the deal? Because there are a lot of risk factors for vitamin D deficiency, essentially, right?
yeah,
And
gosh, the list is
yeah,
long, Bob.
the list is very long. I'll
Mhm.
start with just the obvious
Okay.
one, skin color, right? The darker skin the individual, the harder it is for sun to for the body to process the sunshine through the skin to synthesize vitamin D. So you see a lot of those people with high melanin in their skin have lower vitamin D, and I can tell you this from the testing that I've done with athletes of different skin colors. It's absolutely 100% true. Right. So
Yeah.
that's the first one.
Yeah.
What else do we have here?
Well, related to sun exposure would be how much sun exposure are you getting? So
Mm,
not just skin color, that kind of interplay between exposure and like synthesizing it or that process of synthesizing. But how much sun do you get per day? And of course, where you live can
mhm.
determine that and the weather situation as well.
Totally.
So, like your geographical location and how many of us, when it is, let's say, summer, put sunscreen on. And so we're kind of
Mm,
blocking that more maximal absorption ability from the sun exposure, or those UVB rays
mhm.
to synthesize and initiate that whole process.
That
So,
is so important. Oh my God, because we're
yeah,
athletes, right? And like
yeah.
I've had this discussion with athletes in myself in my head too. I'm like, okay, so what's more important? Vitamin D deficiency or skin cancer? Hmm.
I know.
Right? It's a tough
Well,
decision. Well,
I
it's not
mean,
really a tough decision, but you know what
eh,
I'm saying.
exactly. But,
Yeah.
even my dermatologist, she freaks out like,
Yeah.
what? You're not wearing sunscreen 24/7? Like,
Oh yeah,
oh my
right?
gosh.
Yeah, yeah.
So,
Well, and it's
uh,
not even the whole like it makes like obviously we know being in the sun without sunscreen, increases the rates of your skin aging also, right?
yes,
So it's like the
yes,
whole there's a lot of reasons, and listen, we're not going to tell you why not to or wear sunscreen here, but
right,
yeah, from a vitamin D perspective, we as athletes we do a lot to block the sun. Let's just
right.
put it like that, right? Which is why I think another reason we're seeing such a high deficiency rate in athletes is now also, well, you
Yeah.
finish your point here, and then I want to go to
Oh,
the next one. Yeah.
yeah, there are a few other risk factors. So, yeah, I think we just continue because it's not just about how much sun we get
Right.
or skin
Right.
color.
Yeah,
Hmm.
yeah, yeah. Well, and one that's it's obvious to me because I do work with a lot of different types of athletes is indoor versus outdoor sports, right?
Mm,
So I always ask this, and this is almost predisposes if I try to get an athlete have vitamin D tested immediately or not, is
mhm.
if they play indoor sport or an outdoor sport. So
Okay.
I work with a lot of college athletes, pro sports who are all indoor,
Hmm.
very rarely outdoors. And I'll give some examples here that'll blow your socks off, listeners. That actually blew my socks off too. But you can pretty much say, okay, if you're a soccer player versus a basketball player, most likely now just typing it based on that, most likely the soccer player may have higher vitamin D levels, just based on this little determinant of if you're inside or outside playing your sport, right? That goes on to the, so if we take different sports and the location, but also like with the endurance athletes too, as we know, like you talk about like even swimmers, right? Out open water swimmers who wear wetsuits versus no wetsuits, right?
Mm,
It's the same thing we're talking about here.
yeah.
It's whether it's sunscreen or covering up with clothing. So my point was if it's an indoor versus an outdoor athlete, because that will predispose the heightened need for testing or just the moderate need for testing in my mind.
Yeah,
I want you to
definitely.
talk about the genomics though, Dee.
Oh, yeah. Well, I also
Yeah.
was going to mention clinically or from a medical nutrition therapy approach, those that have maybe celiac disease
Mm,
or some other malabsorption in the small
mhm.
intestine issue, that can be problematic to trying to get our vitamin D levels to an optimal level. And also kidney issues, kidney function, which can be compromised as we age.
Yep.
So, like,
Yep.
my kidneys are healthy, but I'm getting older and our kidney function
Yes. Yes.
slows or changes. And because the kidneys are involved in converting, like from sunshine or our supplement,
Mhm.
well, depending on the kind of supplement form, right? But the
Yeah.
kidneys are involved in getting to that active form of vitamin D. So if we have kidney failure, which
Right.
probably a lot of our listeners do not have, but if we're an older, masters athlete getting it
Mhm.
up there, that can affect also our ability to have that more optimal level of vitamin D, whether it's from food or sunshine.
Yeah, and it's a good point. Really, really quick, just to emphasize the masters athlete, because that was one of them I was gonna just hint on,
Okay.
is that
Okay.
yeah, as we get older, our ability to synthesize vitamin D from the sun decreases because of skin. But then yeah, in terms of different organs, maybe not functioning at their peak capacity anymore. So we do see a lot of older athletes, and unfortunately by older I mean really over, sorry listeners, but over like 40, right?
Mhm.
But we're all in that. Well, most of us are in that category. But that's something to think about. Like, because I hear this too. Well, from let's just pick like a 50-year-old. Oh, I've never had vitamin D issues before. It's always been fine. Well, it might have been 10, 20 years ago, but as we get older, we actually change, right? So
Yeah,
our absorption rate for vitamin D changes. So we should actually have vitamin D measured maybe a little bit more frequently as we get older.
agreed. Well, and then genetics. This is something
Mm,
not mentioned when you read the headlines about deficiency or whatever about vitamin D. Oftentimes, they're not looking at individual gene variants, of which there are many.
mhm.
Amanda Archibald, one of our favorite and like the genomic and nutrigenomic expert in the world. She will give us more insight on this, but the set of genes that are involved in vitamin D pathways, the receptor, the VDR receptor. I mean, there are, gosh, Bob, I was looking at my genomic data from recent or my last report, which was updated with a few new genes. But anyway, there are these different SNPs or alleles that can affect our bone integrity or which is driven by vitamin D uptake. Or, I mean, here again, we can get a little too sciencey because it's so complicated, but
Mhm.
knowing your own gene variants can explain potentially why some of us are chronically deficient despite
Yeah.
taking what we thought was an optimal level of supplemental vitamin D.
Yeah, it's very true, which is another push to have your genomics measured and tested because listen, everyone, we've told you this before. We've mentioned it how many times, Dee, but it's a one and done test. It's probably the easiest thing you could ever do in
Yeah.
your life because you'll never have to do it again. But I have a quick story regarding that, Dee. So I've obviously had my nutrigenomics measured and I've had everybody in my family. So my wife and my
Oh,
three
yeah.
kids, right?
Cool.
And
Mm-hmm.
and it's interesting if we're just talking about the vitamin D. I do not have that SNP or that spelling error on that gene, which suggests that I'm fine, right? Well, when I have my vitamin D measured, it's actually lower than what I like it to be for athletes. Now, it's higher than the population norm, so it doesn't get flagged as insufficient
Okay.
or alarmingly low, but
Yeah.
it's still lower for an athlete. So I actually supplement at different levels throughout the year because I know this, right?
Hmm.
However, interestingly enough, my wife and three kids do have that spelling error on their genes. Isn't that
That
interesting?
is
I mean, you look at
interesting.
that, but
Yeah.
that's why it's been so important for me to get all this data on my family because I want to understand these things and be able to craft nutrition plans and supplemental protocols better. But it just goes to show you, even with me and of one, yeah, I don't have that spelling error yet. I still supplement with vitamin D at different doses throughout the year because of being an active athlete, a master's athlete.
Yeah.
Yeah,
Well, it's also hard to separate. I mean, genes inform, right? But then you've
right.
got these other things like where I live,
Yes, totally.
sun exposure, athlete, optimal ranges, and all these
Yep.
other things that the gene story it helps
Yeah.
to inform. But yeah, it's like, well, we also have to consider what does our blood work show and
Right.
what are our other challenges
Right.
and health risks.
Yeah, for sure. I kind of feel like now we should actually tell listeners why vitamin D is important.
I was just thinking that. Yeah,
Okay.
because it's like,
So,
whatever,
so
I need an
yeah,
optimal range for what
I
purpose?
know, right? So
Yeah.
you're with us so far, listeners, like, okay, this is good information, but who cares? Like, this
Yeah.
is the who cares, so what? So vitamin D, in the past, it's only been related in terms of, what we believe it to be important with for bones in the body, right? That's how we know vitamin D. Oh, it's good for the bones. It builds healthy bones, strong bones, which yes, it will absolutely, right? But there are other things that vitamin D does. So I'll start D just with another
Okay.
one, right? One is helping your immune system. So vitamin D is very important for helping these little things called macrophages and all your immune system cells to boost your immune system and have a healthy supporting immune system. So that actually, vitamin D became really popular with the immune system when COVID was happening because there was actually some research being done on that finding that people with low vitamin D levels were actually more susceptible to COVID. So that's just kind of an
Hmm.
interesting thing. So immune system is my first one.
Well, there's been some research looking at the role of vitamin D status in mood or mental health, like
Yes,
depression, mood,
yes,
and some of that. I don't think there's a consensus or like a whole huge body of scientific evidence to show cause and effect, but there definitely seems to be some correlations between depression or other mood disorders and,
yeah.
low vitamin D status.
That's
Yeah.
exciting to me. Just
Yeah.
with everything we have going on with mental health these days,
Mhm.
that excites me. Just to kind of keep kind of the pulse on the research with that. Yeah.
Definitely. I think it's very intriguing.
Yeah, muscle function. Athletes, vitamin D is actually important for muscle functioning. And it's so funny because here's another story. I this was years ago and I was working with a collegiate gymnast and she came to me just really fatigued, really like, I don't know what's wrong. And we kind of, we ruled out iron levels, like all this stuff, did a dietary analysis, everything. And before we got blood work done, I was like, you know what? Have you ever had, your vitamin D measured? And most college athletes have never had that done before. So I just had this hunch, right, D? So we had it measured, and it was like so deficient, it was alarming, right? So I went
Mhm.
into a protocol that I have in my practice for vitamin D to get her levels up because this was actually a month before her competitive season, and I checked in with her every single week, and every week it was funny, D, because this is subjective, but she's like, in the highest part of her training, she was actually feeling like she had more energy,
Hmm.
which you don't hear very often, right? So
Yeah.
her level, like we almost doubled her level in 4 weeks with the right type and the right amount of vitamin D consumption through a supplement. So I
Okay.
just want to say that you may not like. I always ask athletes, like, if it's abnormal fatigue, then it may be vitamin abnormal, meaning it's just like you don't normally have that type of fatigue, but it's just like weird. You can't really
Yeah.
describe it, right? So
Yeah.
obviously we could be looking at iron, it could be vitamin D related, it could be both, right? Who knows? But that's
Yeah.
another reason why we test and we don't guess, right? So
Hmm.
but if you're feeling like, God, yeah, something's just wrong, it's just off, right?
Hmm.
It honestly could be your vitamin D.
But hold on, listeners, because you don't want to just blind supplement. If you're like,
Oh,
oh, I
so
feel
important.
off, I'm just going to pound the vitamin D. Don't do not
Yes.
do that. Don't do
No,
that.
no, no, no.
But Bob, if you do look at the research, the vitamin D status is again correlated with a number of other health conditions like multiple sclerosis, rheumatoid arthritis, even type 1 diabetes, I think a
Yeah.
little of type 2 as well.
Hmm.
So, and then you read like it's low vitamin D is associated with increased all cause mortality, which is
Yeah.
very scary to
Oh,
read.
yeah. Yeah, yeah, yeah.
Again, it's not necessarily cause and effect, but I think this is one of those low hanging fruit, to like, well, let's just check your vitamin D because what
Hmm.
are the downsides of trying to optimize your status? It's
Yeah.
kind of hard to argue. And there are always outliers, but like
Yeah.
it's hard to argue against ignoring it
Well, and you can't, I don't think you can argue,
or
just go get your
argue.
vitamin
Yeah.
D tested. Like how
Oh, I
it's
know.
just go get it, just know the number. Once you know the
Right.
number, everything can be actually laid out for you. Like, oh, do you need to focus on foods, which we'll talk about
Mm-hmm.
next? Do you need to focus on a
Yeah.
supplement? But it
Yeah.
kind of like everything we're talking about, D, it kind of reinforces the whole vitamin D as a hormone because
Hmm.
there are so many processes that we've just talked about, from the brain to the muscle to the bones. There's even, I mean, seriously, even like the calcium in the blood. I mean, it's
Yeah.
just this vitamin D touches just about everything in your body.
Yeah.
Yeah. So should we move on to foods?
Yeah. Let's talk about the foods
Okay.
because if I can't be out in the sun right now, Bob, can't I just eat the vitamin D in my food?
Totally. You can. But the unfortunate part of this whole story is there are not many foods that I feel, number one, people will eat. Okay, that's number one. But there are not many foods that actually have vitamin D in them. And number two or three to this point, there aren't that many foods that have the high amounts of vitamin D. So
Hmm.
and we could separate this. Remember, we were talking about vitamin K or vitamin D2 versus D3, like ergocalciferol, more
Yeah.
plant-based. So those are like mushrooms, and like I don't even know, maybe some fungi, right? But vitamin D3 is more commonly found in like fish, oily fish, cod liver oil, eggs, although very little in eggs. But my whole point is, like, yeah, you can get it through food for sure. But
Yeah.
I looked this up before we hopped on our podcast this morning. I looked up how much vitamin D in IU's is in a 3 ounce piece of salmon, because that's actually one of the
Oh,
best fish,
we should
right?
probably say how much the RDA is or like
Oh,
the
yeah, yeah, yeah.
recommended, yeah, dietary intake. And then like how much are we going to get through the food?
Set it up. Yeah, yeah, yeah. So how much is the RDA these days, D?
I
Because I don't
think
even
it's
pay
still
attention to that.
I think it's
Is
still
it
600
is it
IU.
600?
Yeah,
Yeah, I was gonna say 800. So 600, 800. Yeah,
I
okay.
think yeah.
So with that said, I mean, if you look at this, it's interesting. Unfortunately, 3 ounces of sockeye salmon has, and it depends on the salmon, of course, but the range is about 4 to 500 IU's, right? Okay,
Mhm.
so if we're going on the RDA, the recommended daily and allowance of vitamin D being 600, and let's just say a piece of salmon has 500, you're getting under what you need. And we're probably going to argue the RDA is way low, depending on what we've seen in blood
Yeah,
work testing with
right.
athletes. So there's no way. Listen, are you going to eat? I don't care if you like salmon and that's the only food you eat, right? Are you really
12.
going to eat it 2 times a day, 3 times a day? I mean, who
Yeah, or
does
a
that?
big 12, 16-ounce
Yeah.
salmon. That is a rarity.
Not many people do that in Western cultures. Let's just put it
No,
that way, right?
this
I
is
mean,
true.
yeah, but it's very difficult. That's what we're saying. Like, can you
Yeah.
get vitamin D through food? Yes, but I don't know many athletes who actually will just jump into the whole, oh yeah, I'll eat salmon every single day
Well,
or eat the right amount.
right, or slurp the cod liver oil.
Oh my gosh, yeah. So
That's
cod
just
liver
another.
oil is actually the highest
It
vitamin
is
D3. I can't tell you the last time I had cod liver oil. I mean, honestly, I'm like,
not on purpose. Nope.
no, no, no. I mean, I mean, so be it, listeners. If you love cod liver oil, we love you to death. We love you anyway. But
Yeah.
it's tough to get down sometimes, is what I'm saying, which is why
Yeah.
people supplement a lot. But no, from a food perspective, just like many vitamins and minerals, can it be done? Sure, but probably not in the levels or the amounts that you actually need it to be
Yeah.
done, right? So for example, or yeah, go ahead, D.
Yeah, well, I was just going to back you up, Bob. Even when you see the cereals and milks and things like
Oh, the fortified,
fortified, it is
yeah.
fortified. I am
Yeah.
covered, but you are not
Yes.
because
Yes,
it's
you are
like
not.
what,
Mm-mm.
100 IU, maybe 50 IU, depending on the
Yes.
product. Like they
Yes.
fortify it, but it ain't doing a whole lot.
Exactly. Exactly. Well, and
So,
and two, like nobody, and here's the thing, like I talk to athletes all the time. I'm like, oh, you taking vitamin D? And if they are, right, my next question is, well, how much are you taking? I don't know. I'm
right.
like a capsule a day, but I'm like, well, but how
Yeah.
much? Like how
Yeah.
many IUs? IU is an international unit, which is usually what we refer to vitamin D, at least in the United States. But that's the thing too, right? You don't know how much you're getting in food. You can't eat as much as you probably need, depending on what your blood levels are. So the next step is supplementing, right?
Yeah. Yeah,
I kind of feel
definitely.
like this is the one supplement. If you were to say minus most test or most research, what supplements are like high on your list to recommend, right? And this is one of them. I mean,
Hmm.
but here's my big but. I will never supplement by
Do you have a big butt,
I don't think
Bob?
I do. I actually don't think I do. I
Okay.
need to do more squats and
But
lunges. I've been
anyways,
working on that, by the
I
way.
know.
Um, that was funny. Right when I said that, I was like, oh, Dina's gonna
I'm
laugh at that
sorry.
one.
You
That's
would have
okay.
called me on that one too. But anyways,
I would have
all
totally.
right. But do
So
you were,
my big butt is, well, wait a second here. If you I can't even remember where my thought
I
process was
know.
because the whole big
Well,
butt thing.
if we're gonna supplement
Oh yeah,
something,
thank you. So
yeah,
the big but is there are different levels of supplement that I would give you based on your blood work. So you can't
yes,
just come up to me and say, "Oh, I'm low in vitamin D. How much do you recommend?" Like you would have to say, "Oh, my level is this number, and this is the amount I would recommend," because the whole goal is to not under supplement and also not over supplement. Because one thing we haven't mentioned is vitamin D is a fat soluble vitamin, which means what, Dina?
yeah, it's going to be absorbed more efficiently with some dietary fat, but we also
Mhm.
store it
We
in fat
store
tissue as
it,
well.
which means
Yes.
it can actually build up
Yes.
if we are over consuming it chronically. Let's put it that way,
Yes.
right?
Well, Bob, I mean, this is where we need to personalize some things with supplement our protocols and so forth. So
Totally.
I think we've covered a lot of great aspects here of vitamin D and some importance. So getting into the weeds a little bit more on the supplement protocols that we advise and prescribe, Bob. You listeners that want to get into that, please head over to our Patreon community and get the scoop. Patreon.com/ISN podcast. We're going to give you our breakdown of the protocols.
Like our exact protocol. Like if your
Yeah.
vitamin D level is 35, here's
Yeah.
how much you should supplement with vitamin D and how long, right? So
Yep.
we're gonna get in the weeds, just like you said. So yeah, listeners, seriously, this is gonna be a huge resource, but yeah, we have to push you over to our Patreon account for this special edition.
Yeah. And then you can ask some questions over there as well. So thank you so much for tuning in. Hopefully, you go get your vitamin D level checked pronto.